During a time where governments are fighting against the spread of COVID-19 throughout the world, reliable information on public health is crucial, but misinformation or fake news might be spreading faster than the facts. According to a global study done by Statista in March 2020, 74% of the respondents were concerned about the amount of COVID-19 fake news being spread, and 45% felt it hard to find trustworthy and reliable sources. This might result in panic and anxiety in the generic populace. So to tackle this issue, we have narrowed down to two main drivers for this infodemic: health literacy and digital literacy.
Health literacy is defined as the ability to understand and use healthcare information appropriately. A recent study by the Institute of Health in Malaysia showed that 35% of the population has limited health literacy, and this population mainly consists of people from rural areas, people who are less educated, and elderly who are above the age of 75. With a lack of health literacy, this might result in many dire consequences, such as making inappropriate choices when it comes to healthcare. In addition to the lack of health literacy, there's also a gap in the fact-checking by the generic populace. And this can be attributed to two different factors. One, with the lack of digital literacy and accessibility, and two, a fact-checking platform. This can be seen in rural areas in Malaysia, such as Sabah and Sarawak. Many of the population are either lacking the devices that allow them to be connected to the internet, or they are already equipped with the devices, but they lack the infrastructure and adequate training to be connected. Furthermore, there's no reliable rumor search engine that allows for the ease of fact-checking.
We are Team Mentyi.
We as a team believe that in order to improve health literacy sustainably, we need to improve digital literacy first. Hence, we came up with a new application function that's integrated to the current MySejahtera app. MySejahtera is made compulsory to user by the Malaysian government for this current pandemic. Our extension provides user a means for fact-checking and doubles up as an educational platform to improve the health literacy of the users. Through the collaboration with organizations like APRU and MCMC for the application, we will be able to implement those new functions. Now, we will be looking at some of the new functions we would like to introduce. At the homepage of the app, there will now be a chatbot that users can ask general questions like, where is the nearest hospital? And, is this particular article true? The chatbot is trained to guide the user to the part of the application that they think would be of help. There are now two new sections to this app: the News Tracker and Education. Now, moving to News Tracker section, we will come up to the main page where we can see three options. They are Rumor Site, Rumor Submission, and Search section. There will also be a pop-up reminding people of the current government law regarding spreading of any false news. This menu icon will allow quick access to other application functions. The rumor site will bring us to a page where all those true, false, or undetermined rumors are reviewed by professionals. The ones with green tick are true, the red cross is false, and the yellow ones are still being checked. Those with a yellow icon are highly recommended not to be shared, as it is not confirmed. This rumor submission area will allow users to submit articles that they have received or read but are unsure if it is credible. This request will undergo a thorough check before anything is published or confirmed. The next function in our app is the search function.
Now, let me bring you through the back-end process of our fact-checking function. Firstly, a few trusted sources such as the Department of Statistics Malaysia, sebenarnya.my, World Health Organization, and US Food and Drug Administrator are selected as our databases. From here, an AI model will be trained in order to cross-check and to identify the keywords input by our user. So whenever a user wants to search for a particular news, all they need to do is just to enter the keywords. And this function allows the user to obtain all relevant information about the search news. On another hand, for non-existing keywords, the user will have to make a report about the news. So this news will then be labeled as pending and it's ranked according to their reporting frequency. So here is a place where a human moderator will have to come into the picture and to carry out further investigation and verification. So after verifying the news, the validity of the news and relevant information will then be updated to our existing data bank.
Next, we'll proceed to the education section that aims to tackle health literacy. As you can see from the application screen, there will be different education videos for health and digital literacy. This will equip more people with the needed knowledge in terms of another pandemic. When you scroll down the screen, a mini flashcard game is available for health literacy self-test. The purposes of having the mini game are: firstly, let people apply what they learned from the previous education sections, and secondly, to better engage and attract users. In summary, the two main functions introduced to MySejahtera app are News Tracker and Education. All these new functions are believed to improve the public's health literacy, tackle the issue of digital deficiency, and relieve the infodemic phenomenon. Our implementation plan includes both short-term and long-term stages. To begin with, health literacy pre-surveys from the public will set as a baseline. All the education videos will be uploaded into the app within the first 3 months. Moving on, we'll target more on the rural areas and equip the citizens there with smartphones using the national phone subsidy. At the steady operating stage, while maintaining constant video updates, biannual public surveys are used to test health literacy improvement. When the pandemic is over, our graph video resources are to be uploaded and stored on the cloud for future reference. Over the long term, we also plan to hold volunteer campaigns to reach the tech-deficient communities and teach them on smartphone usage. By 2032, according to Malaysian National Plan, the digital infrastructure will be ready. Both digital and health literacy are expected to be improved.
These are the possible challenges. Firstly, cultural incompetency. Malaysian populations consist of different races and mother tongues. Thus, AI-based sound recognition and translation will be needed to cater the needs for people of all backgrounds. Next, application-based challenges such as data privacy, security concerns, and also lagging processing. Constant software upgrades and improvement will be needed to overcome this challenge. Thirdly, digital gap due to the lack of internet infrastructure in rural areas. With the ongoing Malaysia Digital Economy Blueprints, more internet stations will be built to bridge the gap. Our health literacy improvement can be assessed by the score improvement from our app survey. Other assessment includes a decrease in the search or report frequency or an increase in the number of visitors to our education section. Here is our budget analysis table. As our app development approach is through hybrid platform, thus we can save money by building only one application for all the required platforms. Team aims to collaborate with Ministry of Education Malaysia in promoting the additional education section for youth. Besides, our team also plans to partner up with Mampu in building a blockchain for our databases. Next, we also aim to partner up with Huawei Malaysia in building an ideal machine learning mechanism for fact-checking features. In terms of sustainability, these features can be customized for future pandemic. Next, health literacy can be improved sustainably through up-to-date videos and also marketing campaign. In terms of scalability, our app is available for nationwide usage with high rate of adoption. Lastly, just click fact check before spreading. Thank you!